Dr. Aditi Nerurkar, a Harvard physician, joins us now with more. Dr. Nerurkar, you tweeted about the trauma refugees are facing right now, and you said, quote, "I'm a doctor with an expertise in stress and resilience. I've also worked in refugee health with the WHO. I want to caution us against glorifying the trauma of the Ukrainian people." What did you mean by glorifying? Can you talk to us really about what happens psychologically when humans go through trauma?
Yes, Morgan. You know, the psychological impact of war far exceeds the physical impact of war. And so what we often see with these forced migrations is a loss of certainty in every aspect of life. So it's not just a loss of place or a home, but also a loss of control. Trauma of war changes the brain. So we may see PTSD, anxiety, and depression during and immediately after, but also months and years later.
And, of course, there are many people who suffer both physical and emotional trauma from this. But can you talk to us about children specifically? I mean, what impact is this having on young minds, young people?
So, Morgan, children and the elderly are particularly vulnerable. Kids thrive when there's structure and a sense of psychological safety. So the first step for refugee children is to reestablish routines, meal times, playtime, schooling, and to understand that even if kids are smiling and happy immediately after or during that forced migration, it's not necessarily that they are also not deeply traumatized.
And given your experience in this field, I mean, what do you think is the best way to treat people in this case? And really, what can the rest of us, all of us, do to help?
So in the immediate term, Morgan, it is all about the immediate needs, safety, shelter, and food. But in the long term, when we're thinking about post-conflict reconstruction, mental health has to be a priority. Mental health challenges happen long after the last bomb has been dropped and the aid workers have all gone home. So it's important to remember this for the long term.
Definitely, for them to understand that there's still a big, formidable fight ahead. Dr. Aditi Nerurkar, thank you so much.